Well, it's been about 6 months now that we've been using the Isolite, and it's really been an interesting experience. You know, when we first got it, we really thought we were going to be, adding efficiency to our practice and more comfort for our patients. I mean, that's absolutely true. Doing those ROI calculators to sort of see what procedures we would use it on absolutely helped. But what we found is what really made a difference is it's almost a level of control. We work in an environment in which we don't have any control. We can't control the moisture, we can't control where the tongue goes, it's dark in there. But with the Isolite, I was able to actually do that. I could control the thing. I could keep the tongue out of the way. I can control the level of moisture, humidity in there. I can control the light. I can still see while we're curing in a composite. So, using the cure safe mode. So all of a sudden now I have an element of control, and what I found was the side effect of all that was we ended up doing better dentistry. Before it was use the rubber dam, use the rubber dam, use the rubber dam, and the rubber dam frankly is a pain and it's uncomfortable for the patient. Nobody really likes doing it, even though we know that the isolation we get from that is, especially for bonding procedures, is fantastic. Well, the Isolite allows you to do that same level of control and isolation without having to mess with the rubber dam and punch holes and have it rip and be uncomfortable for the patient. So now we're finding we're using it kind of on everything. We use it when we place implants to keep the tongue and cheek out of the way and to keep saliva out of the field. We're using it on bonding procedures. We're using it, our hygienists are using it when they do cavitron procedures. So we feel like it's kind of raised the bar. Because we can control that environment, we can see more, do better dentistry than we really ever did before. To me, that's the biggest impact that Isolite had on our practice.